A video currently doing the rounds on social media shows what looks like a parking lot converted into a spillover facility for COVID-19 patients in KZN. The video, which you can see now on your screen, shows rows of hospital beds and oxygen tanks outside what is alleged to be the Northdale hospital in Pietermaritzburg. Now, radio producer Hlengiwe Khumalo, who actually took this video, says that it's where her father actually took her last breath. Hlengiwe is actually joining us now via our Zoom link for more. Hlengiwe, first let me start off by sending my condolences to you and your family during what is undoubtedly a difficult time. Perhaps let's begin with you explaining to us what happened.
So
Hlengiwe,
and then on Friday, Can you hear me?
Yes, I can hear you now. Sorry, if you can just start from the beginning, because we lost your sound there at the beginning of your response.
Okay, so I was saying that my father had been having difficulty with his breathing for the most of last week. And what happened then on Friday is that my brother and sister took him to Northdale Hospital. This was around about 7 p.m. in the evening. Upon arrival, he was put on a wheelchair because he could no longer walk. And he was then taken to one of these structures that you saw on the video. He was attended to by a nurse who conducted a series of tests, including the coronavirus tests. And during all of this, my father said to the nurse that he was feeling cold. And the nurse responded with, unfortunately, there's nothing that she could do about it. My sister then came back home to get a blanket and a hat for him and went back to the hospital. Later then, he was then put on a bed. And there were other patients as well in that structure who were also on beds. And then my siblings left him there around about 11 in the evening, 11 p.m., and he took his last breath at 2 a.m. in the morning.
Sure. It's quite a difficult situation to try to come to terms with. Were you aware of the conditions that he was being kept at when you delivered him to the hospital? Did you get an opportunity to see where exactly he might be staying?
Not at all. It was a shock to my siblings when they arrived and were told that they would not be going to the main building of the hospital, but will instead have to go to the makeshift parking lot structures that were erected.
I'd imagine, of course, the immediate response is to try to get answers from health officials who are attending to him. What are they saying?
Like I said, the nurse told my father, when my father said he was feeling cold, because at that point he was literally shaking, and she said there was nothing that she could do about it. Sure.
The makeshift arrangement that we're seeing in that parking lot is certainly for many South Africans the first they've seen. Have you come across anything that might resemble that kind of arrangement before your father went there? I mean, you're already saying that your family was taken completely by surprise when they found out that this is actually where he was staying. Had there been any kind of explanation that, look, when you come to this institution, this is possibly where your loved one might actually have to get his treatment?
Not at all. And the reason that we took him to that hospital is because it's the nearest hospital to us. Otherwise, we could have gone to maybe Edendale Hospital or Grace Hospital. But because Northdale Hospital is about 5 minutes away from the house, we thought it's best to take him to that hospital because at that point, he was really struggling to breathe.
Yeah. Makes complete sense. Okay, let's try to get you some reaction on the story now. We're joined on the line by KZN's Health Department's HOD, that's Dr. Sandile Shabalala. Doc, thanks for your making time to chat to us. I imagine you might have heard what Hlengiwe has had to say. Let me start by asking whether you were aware of the conditions that some COVID-19 patients have to stay in, particularly at that hospital in your province.
No, good morning. Let me start by saying that I didn't hear Hlengiwe's responses, but that said, let me start by sending our condolences to the family for the loss, and then say that we are investigating the case. We saw the video. It was sent to me last night, and I'm investigating what happened. I therefore will not be having any details now, but it's a case that we're going to investigate, and as soon as we know, we'll be able to communicate properly what exactly is reported to us as the Department of Health.
Dr. Sandile, I'm sure you'll agree with me that it's called comfort to be investigating this incident after the fact. The big question becomes, how did this happen under your watch without you even being aware that it's taking place?
Look, if I was to try and answer your question, I would be sending aspersions when I don't exactly have details. What we know is that because of the COVID, we have asked all institutions to have what we call fever clinics. This is where patients come in and they are triaged. We call it triaging, where we separate people according to whether we suspect them to be having fever and other symptoms that may say that they've got COVID. And in those fever areas, we then decide whether a person deserves to go to an area where they are a person under investigation, they deserve to be isolated, or they deserve to go to general care. Now, these fever clinics, some of them are so open that the staff wants to make sure that they are open. There's a lot of aeration in that area. So, in this case, one has not been to the area exactly, so it would be difficult for one to give you the detail that is necessary to really say what exactly happened. And this is not only an investigation that we must do, but we must also do an investigation to say, in this particular case, what really were circumstances, then we'll be able to report. I would not want to say anything other than that, because it would say, I suspect from something that I have not heard, and it would be wrong, I want to believe.
Now, some of the details are already clear, Dr. Sandile. One, we know that Hlengiwe's dad actually didn't have just a mild fever. He couldn't breathe. So already we should be asking serious questions about why he wasn't actually treated in the main sort of part of the hospital and not just at these fever hospitals, I think is what you're calling it. But I guess, the second concern is around whether or not there are still people being sent there at the moment. Even if you are trying to get to the bottom of what happened, can you at least safely say that that aspect of the facility has been shut down?
Remember, the spread of the virus says that we must take all circumstances to ensure that we do not spread it either within or the institution or in the community. And the fever clinics were designed to ensure that the people who are suspects for COVID, or the people who come in already knowing that they've got COVID, are treated in a certain way. So having fever clinics is going to continue being there. We may need to improve if there is a fever clinic that is not working very well, but we are not going to do away with fever clinics, because they assist us to ensure that we do not spread. And in this instance, as I say, I then need to go back and say, in this case, what exactly happened, and then be able to answer correctly. The distance that is expected of people, we agree it has to be there. And you are saying he did not breathe. Among the other challenges that people with COVID will present with is difficulty breathing. But difficulty breathing can come for many other reasons. So we then investigate all the issues around the patient. So that is why I'm saying, yes.
From what you've seen now and from what we know as fact from Hlengiwe, are you happy with how this particular facility is running?
We're talking about this fever clinic. The institution has been running, and we've not had issues with it.
Yes, I'm talking about this particular fever clinic. From what you've seen and from what we know from a bereaved family, are you satisfied with the fact that this clinic might potentially still be operating as we speak?
I have said to you, I have not been to the fever clinic myself. So for me to be satisfied, I must be either have been there or have been reported to say, here are the challenges in this fever clinic. Then I can be able to say, here are the challenges, and this is how I'm going to
Dr. Sandile, with respect, the visuals, yes, I think, paint a clear enough picture about whether or not this will be an acceptable place to be sending a loved one who's potentially on the brink of taking their last breath? From what you've been able to see, I mean, through your own admission, you've seen this video yourself. Are you happy with even just the arrangement of this makeshift clinic?
I think I'm answering this question not for the first time. One, we have made makeshift fever clinics not only in this institution. And the makeshift clinics are not the best thing that we are having because they are makeshift clinics. Now, in this instance, I've not been to the clinic, and what I am seeing is, unfortunately, what was sent to me was an empty area where you would expect that people go in and pass, and they are triaged and pass. That's why I mentioned the triage area. So I then need to be able to get more details than what I have for me to answer you much better. Than I know you are uncomfortable or feeling I've not answered you enough, but I would need to get more details to answer you better.
No, you're absolutely right. My question is still largely unanswered. But let me bring Hlengiwe back into the conversation. Hlengiwe, I'm hoping you've been able to listen in on what Dr. Sandile had to say. Let me just get your initial response and gauge whether you're satisfied with that response.
Not at all, not at all. First of all, those structures need to be dismantled. That's the first thing that needs to happen. No human deserves to be in those. And I'm not satisfied. I mean, we're told that government had been going around and seeing these COVID-19 hospitals and making sure that the state of readiness for these hospitals is on point and on par. But clearly now the HOD is telling us that he hasn't seen this hospital. He hasn't been to these, so he has no idea. I'm not happy with him saying that he doesn't know what's been happening at a hospital under his watch.
Absolutely.
To know what's happening in all hospitals in the province.
And, you know, Dr. Sandile, there's also been, there have been claims, assertions, assurances from the state about the creation of field hospitals. And I guess at this moment, one wonders whatever happened to that. I mean, in an environment where there's a field hospital, one would have thought that patients like Hlengiwe's dad could be taken to that kind of facility versus these fever hospitals that we're hearing about for many people for the first time from you.
Yeah, so I think you're missing the point on this one. When a person goes to the fever hospital, a person would have gone through this fever clinic, a person would have been diagnosed in a certain direction, a person would have gone through the investigation, a person would have gone through the triage. So the fever clinic is the initial point where people get in. But the field hospitals are institutions where we're going to be isolating people who already are positive in terms of coronavirus. So in this instance, I don't even know the condition Gababa, and as such, I would not say whether he deserved to be in the fever clinic. But also, if he was having difficulty breathing, we would not have sent him to a fever clinic because we would have to investigate the reasons behind his difficulty breathing.
Okay, so what you're saying, Dr. Sandile, is he shouldn't have been sent there to begin with?
No. I'm not saying that.
But he had difficulty breathing, and what you've just mentioned now is that if people have difficulty breathing, they shouldn't be sent to these fever clinics. Set us straight then. What are we misunderstanding here? We are
misunderstanding the fact that a fever clinic is not a field hospital. That's the misunderstanding we're having. Secondly, we are misunderstanding that a fever clinic is meant to triage people before they can go into the hospital and then be taken to either an isolation area or where we take people under investigation or where we take people who will need to be admitted under general care. So that's a fever clinic. A field hospital is an admission area with a diagnosis already having been made. So you are making a mistake there. You are missing that point.
Okay, we are out of time, but let me ask you this question, Dr. Sandile. In these fever clinics, are patients meant to be sleeping overnight? Are patients meant to be kept there overnight if for whatever reason they can't be sent back home or can't be sent to a field hospital or the actual main institution?
No, in fever clinics, as I say, they are triage areas. They are not meant to be there overnight. As far as we know, the fever clinics are supposed to work 24 hours because they aim to triage people, to separate people as and when they come into the hospital. When they've been separated, then they get to be taken to the correct areas of the hospital.
All right. Dr. Sandile, let me thank you for your time. Dr. Sandile Shabalala is the HOD of KZN's Health Department. Anyway, I have to have you have the final bite on this. Your response, your salient sentiments, given what the HOD has had to say?
This is a classic case of me and my family demand an explanation from the CEO, a better explanation than what the HOD has given us. We demand an explanation from Dr. Zweli Mkhize. They must tell us what happened to our father. Why was our father put in those makeshift structures?
All right, we'll leave it there. Thank you very much, Hlengiwe, for sharing your story with us. And once again, condolences to you and your family. Hlengiwe Khumalo is a radio producer, but also, more importantly for our conversation, is the daughter of a man who we now have learned took his last breath at what is now being called a fever clinic in KZN.